So I am very excited to chat with Dr. Lorraine Maita. We are going to be talking about thyroid and autoimmune issues in women. And so let me go ahead and dive into Dr. Lorraine's bio here before we start the conversation. So, Lorraine Maita, MD, the hormone harmonizer and detoxifier, is a triple board certified physician who specializes in helping you have boundless energy, stable moods, a lean body, sharp, clear mind, strong bones, and balanced hormones so you can feel like yourself again. And thank you so much for joining us, Dr. Lorraine.
I'm so happy to be here. We've got to get the word out to help women have a healthy thyroid because it's a very prevalent thyroid disorders are very prevalent. It's and especially in women. And I want to talk about why.
Yeah, no, we definitely will talk about why. But before we do that, if you could expand a little bit on your background. So how did you know how did you start focusing on hormones, becoming the hormone harmonizer and detoxifier?
Well, the odd thing was I used to work in an emergency room in New York City, and I actually got into functional medicine because a patient gave me TB. I was on antibiotics for 9 months, and I was getting all kinds of gut issues and all kinds of issues, rashes, gaining weight, feeling tired. And then I got myself together and learning functional medicine. And then I went into a company. Now, I used to save people's lives in the emergency room and in the hospital. And one day, and back in the day, there were very few women executives. So one day I'm in my office and a really senior woman came down, not senior old, but she was, like right next to the chairman, and came down and said, "You have to help me. I'm standing giving a presentation, and all of a sudden I get a hot flash. I'm sweating. I'm forgetting my words." And men were either casting their eyes down and like, "I can't look at this," or elbowing each other, chuckling. And she said, "People are not going to take me serious." And in those days, there were very few women executives. I mean, I could probably count on one hand how many there were in this huge Fortune 100 company. So I had to be like, "Oh my God, I could fix almost anything, but not that." So I started to learn and I did these women's circles and they laid everything out on the table. I was a newbie, I was young, and I learned so much from them, and I continue to learn. And then I went through my own perimenopause, which was really difficult. And I started losing friends. I was irritable and tired all the time. I was moody, gaining weight. I'm like, why all of a sudden I'm doing all the right things? And the light bulb went off. I said, "It's perimenopause." And, I dove deep into that. And then I've never looked back because I've helped so many women because they're either drugged or dismissed. And that was the same thing that happened to me. And I also do hormones differently because I went to about 4 different doctors and they'd give me the standard of what they did. And if it didn't work for me, which it didn't, you out of luck. So I trained it probably under 6 different philosophies. So I feel like I'm like a chef. The difference between a short order cook and a chef, I can take a little from here, a little from there. If something doesn't work for you, I have some other bag of tricks. But I also look at the whole person, and I found that that makes all the difference in the world. You can't just give somebody hormones and say everything is going to be fine. Even if you tailor it to them, there are so many other things that come into play.
Yeah, I agree. I mean, there's definitely a time and place for hormone replacement therapy, which we'll talk about. But the problem is, there's a lot of doctors that's all they do. They just give the HRT and they're
Right.
not doing anything to improve the person's health in other ways. So that's great that you take that whole body approach, and it's so important.
Yeah, it makes I found that the people who had some side effects or did not feel right on hormones, it was because of something else, their gut or their thyroid. And the thyroid, again, I have a lot of patients that are dismissed. They're tired, they can't think, they're constipated, they're cold, they have all the symptoms, and then the numbers look good. right? The numbers. We're not treating the numbers, we're treating the patient. So again, getting your whole body in shape and getting everything else in shape, sometimes your thyroid bounces back, but their thyroid is very overlooked, even though it's so prevalent.
Yeah, without question, still overlooked, still misdiagnosed,
Yeah.
unfortunately. Yeah, so, of course, we're gonna talk more about this, but getting to the question, why are thyroid conditions so common in women specifically?
Well, women have more estrogen. We have that X chromosome, and there's something about that X chromosome and estrogen that kicks up your immune system. Estrogen, unopposed or not balanced by progesterone, can be very inflammatory. And a lot of women are on the pill, or they've had IVF, but oral estrogen will increase thyroid binding globulin, and even your own estrogen will increase thyroid binding globulin. And the thyroid binding globulin holds onto the thyroid so that you can't allow it to be free to get into the cell. Hormones, these types of hormones work by getting into the nucleus of the cell. If they're bound, they can't. So it's like people being in a train station, in a train with a door locked. They can't get out. They're not free to go to work. So we need to have estrogen in a good range. And a lot of women are hyperestrogenic. They're estrogen dominant, which means they have estrogen, but they don't have enough progesterone to balance it. And estrogen will make your thyroid grow. I mean, I realized late in life that I was estrogen dominant. I didn't know what it was when I was a medical student. And everybody, my thyroid is a little bit big, and everybody had to feel my thyroid. Any rounds we went on, any type of clinical training, people would always want to feel my thyroid. I never had nodules, but too much estrogen, not opposed, not balanced with progesterone, will make the thyroid grow. Too little, you get hypothyroid. And hormones fluctuate. You know, we go through stages in life where they fluctuate, and especially during perimenopause. This is when I was gaining weight and all these other things were happening to me. And I really wasn't sure. It was around the time of 9/11, so I thought I was just stressed, right? Who wasn't stressed then? I used to live across the street from the World Trade Center. And when I realized, oh, wow, let me balance my hormones, I had the same stress, but I reacted very differently to it. So estrogen will change the ability of thyroid to be able to work. And it also can decrease your thyroid making conversion from T4 to T3. Progesterone increases T4. T4 is actually the hormone made in the thyroid. So having the right hormones in balance on board is really, really important, because we're built to make more, to have children, right? And if the thyroid is off, you have infertility, you have abnormal periods. And people always think it's just estrogen. No, it's not just estrogen. It's the whole symphony of hormones. So I think women are more prone to thyroid disorders because of estrogen and the X chromosome.
All right. Well, thanks for sharing that. So, estrogen, if someone has like estrogen dominance, you said it could interfere with that conversion, the T4 to T3. And then when you said it could make the thyroid grow, so you mean it could be like a factor when it comes to like a goiter, like an enlargement of the
Yes,
thyroid?
yes. Too much estrogen and not opposed with progesterone is going to make the gland itself grow, and it can cause goiter. And too little is hypothyroid. It plays a role. Estrogen, people think it's just for reproduction, and it's not. There are estrogen receptors all over your body, in your brains, in your blood vessels, in your kidney, in your skin. I even had one woman who had a rare disorder that there's estrogen in her glottis. I mean, I had some dairy last night, so I'm a little a little congested. I was at an event where I had no choice. So you see, food sensitivities play a role too. And I broke my own rules last night, but I couldn't help it.
Yeah. Well, I can't, for the most part, I avoid dairy too, but I can't say I'm perfect when it comes to dairy. I kid around sometimes if I have pizza, it's usually a cauliflower crust, but it's not the artificial, or not artificial. It's not the vegan cheese. It's the I'm gonna have my mozzarella when I have my cauliflower crust pizza. So I'm not perfect either when it comes to that. So, um, what autoimmunity, like most thyroid conditions are autoimmune. So most hyperthyroid conditions are Graves, most hypothyroid conditions are Hashimoto's, and similar autoimmunity also more common in women. Is that for similar reason because of the
It's
estrogen as well?
So we've evolved to have children, right? And women have 4 times more antibodies than men. So, and it's estrogen that gives you all those antibodies. We have more antibodies to protect the unborn child and to also be able to transmit the antibodies when they were nursing, so that it keeps the infant healthy and it protects the mother against infections. So that's a double-edged sword. It does protect the infant, it does protect the mother, but only against infection, but it increases the risk of autoimmune disorders. Because, I always look back, and I have a woman look back, what was happening at the time you first noticed something going wrong? And it's always when your hormones are changing and either you have stress or infection. So when you're pregnant, your antibodies are at their highest. And that's when we see the biggest number of autoimmune disorders occur postpartum. And I call them the 4Ps, because this is when hormones fluctuate. Your pituitary gland in your brain doesn't know what to do, and it signals the making thyroid hormones and making all your other hormones and your sex hormones and your prolactin, which makes milk, your estrogen, your progesterone, your growth hormone, your thyroid hormone. So when you have fluctuating hormone levels, the signals get crossed. And some women during puberty, estrogen is easy to make. Progesterone, no, you need to actually have an egg ripen and burst. So they call it the follicular phase, and the corpus luteum from that egg that has ovulated, that piece of tissue makes progesterone. So that doesn't always happen very easily. So during puberty, your estrogens are ramping up and your body's trying to ovulate, which is it's a very synchronized process. Postpartum, your hormones are at a high level and then all of a sudden they plummet. And some women bounce back fast, other women don't. Perimenopause is probably one of the worst times because both hormones are fluctuating. Estrogen goes up and down, and that's why thyroid disorders are very common then, because all those signals get crossed because your hormones are all over the place. And where in puberty progesterone is ramping up, in perimenopause it's ramping down. We're born with a set number of eggs and we start running out. And some months you'll ovulate and things will be nice. Other months you won't, and you'll feel anxious and irritable and tired and PMS and get breast cysts and fibroids and irregular bleeding, heavy bleeding. A lot of the, and you can get hot flashes and night sweats too, because even though you're not making progesterone and you're estrogen dominant, your estrogen is fluctuating up and down. So a lot of the same symptoms in menopause occur during perimenopause. And all these fluctuations mess up your pituitary gland, and they also stimulate the immune system. And once your immune system kicks off, if you have the genetic predisposition, it doesn't know how to turn off. It turns on, but it doesn't know how to turn off. And that's why most autoimmune disorders in women occur during the 4Ps: puberty, postpartum, perimenopause, and postmenopause. And Graves, I understand you do a lot with Graves. It's very, very common postpartum. Did you find that to be the case?
Yeah, I mean, I do see women also, who's premenopausal too. It's not just postpartum, but yeah, I would say I also see a good number of women with graves when it develops in postpartum. So but you are right with the hormone fluctuations. I mean, sometimes we'll see teenagers with, I mean, not a lot. Most of the women I'm seeing are adults, but it's not uncommon for, or it's less common, but these days, unfortunately, it's more common than in the past to see, which kind of suggests also there are other factors too. And I think you would agree it's not just the hormone fluctuations that's
Yeah.
responsible for thyroid and autoimmune thyroid conditions, but when in combination with other factors, as well. So,
I call it the autoimmune soup. It's stress, toxins, adverse food reactions, inflammation, hormone imbalance, nutritional excesses, nutritional deficiencies, lack of sleep. People say, what affects my hormones? If you give me hormones, am I going to stay at the same level my whole life? No, not really, because what you eat, what you drink, how much you sleep, how much you exercise, the stress you're under, and the toxins you're exposed to are all going to affect your hormones, your thyroid, and also your estrogen and progesterone. And most of the chemicals out there, a lot of them are estrogenic. So all these herbicides and pesticides act like estrogen, and women are estrogen dominant without estrogen, right? Because they're taking these chemicals in, not knowing, like, we're exposed to about 200 chemicals a day, especially women. We use personal care products. I use something on my hair, my face, my makeup, body lotions. I don't use perfumes or anything anymore. I don't even put nail polish on anymore because I just don't, I don't need to. I don't want to. I'll do a little bit of makeup, but, not every day. But we underestimate, even if you've eaten clean and had a clean lifestyle for the last 5 or 10 years, every toxin you've been exposed to since birth gets stored in your fat and your bone marrow. And when it starts releasing, it starts in perimenopause. So women wait to menopause to like get all this testing done, but perimenopause, everything starts to go downhill, and that can precede menopause by 10 years. So perimenopause is big for autoimmune disorders, postpartum, and postmenopause. In fact, I just had a podcast with somebody about the oral microbiome. Women get dry mouth and they get more infections after menopause because estrogen makes saliva. And then the infections can affect your thyroid. They can affect your cardiovascular disease. So it sets up a chain reaction of so many different disorders, so that getting things in balance is extremely important. And especially for your thyroid. It's the canary in the coal mine. It's going to be the first organ to show some signs of having a problem. But people don't look for the problems in the thyroid. They don't measure antibodies. They don't look at free T3. They don't look at reverse T3. They're allowing the lab reference ranges to dictate the patient's health, and that's not the case.
yeah, I agree. It's funny you mentioned the term canary in the coal mine. I just had another interview and she also said the same thing with the thyroid being the canary in the coal mine, which I agree. It's not the cause of the problem, and I agree with most doctors not looking at the full picture when it comes to testing the thyroid. Most just doing TSH, or some just doing TSH and T4. And then looking at, you suggested about the lab ranges versus the optimal ranges, which still too many doctors also don't pay attention to those optimal ranges. So I appreciate you bringing that up. When it comes to sex hormones, and you mentioned perimenopause, how challenging is it to test the sex hormones because they're fluctuating? So, I mean, how do you handle the testing of progesterone and estrogen during those times?
That's a good question. If somebody has a regular period, I say do it. If it's an average 28-day cycle, do day 19 to 22. Measure your hormones then. If somebody has a shorter cycle, I measure day 16 to 19. And some people who their periods are all over the place, I tell them measure 2 different times, 10 days apart. Or when you're having raging PMS, measure that and it'll give me an idea. And then because your cycles are all over the place. And then a lot of women don't know when to test. So I give them a graphic and I show them like this. And I say, here's 2 lab slips. Do one when you think you should be doing it, and then do another one 10 days later. And one of them is going to show, because we're looking for having estrogen and no progesterone, because at the beginning of the cycle, you don't have either or very much of either. 2 weeks, estrogen goes up first, then progesterone goes up after you ovulate. And then after that 2-week period, both drop again. And that's when you're supposed to have your period. But when you have estrogen and no progesterone, the uterine lining just grows and grows and grows. Progesterone stabilizes it, but you don't have progesterone to stabilize it. So it may grow to a point where it's breaking off. So you get irregular bleeding or spotting. So you don't know, is this a period? Is this not a period? That's why sometimes you have to do 2 different tests, two different times, 10 days apart, or when you're having symptoms, because oftentimes when women are having the most PMS type symptoms is when you have that imbalance, because that's what's causing it. I call estrogen the hormone of energy and growth. And too much energy is anxiety, irritability, impatience, insomnia, growth of the breast, cyst of the breast, tender breast, bleeding, spotting, fibroids, weight gain, and more. But those are your most common symptoms. And, progesterone just calms it all down. So estrogen's inflammatory, hence all the extra antibodies. Progesterone's anti-inflammatory. So when they're ramping up in puberty, when they're all over the place postpartum, and when they're ramping up and down in perimenopause, you're going to get the antibody spikes. But then when estrogen is low, you're not going to get the thyroid hormone. You're going to be, what women tell me is like, I lost my zest, or I lost my effervescence, or I lost my luster. I just don't feel like a woman anymore. And I do see tremendous changes in the thyroid as well during that time, and changes in the microbiome, and changes in the oral cavity, and dryness. They're dry, they're foggy, they're hot flashes, night sweats, sex is painful. It's not fun to go through these, but the beauty of it is, even if you didn't go on hormones, you can improve your life with just improving your overall health, like your microbiome, your detox pathways, and getting your thyroid in order, because no one would question if you're hypothyroid to give you thyroid. But people, when you're low in estrogen or progesterone, they were like, no, that's a natural phase of life. Well, yeah,
Yeah.
but it's affecting the quality of life.
Yeah. No, I agree. That's a really good point. If someone has low thyroid, there's no hesitation to give thyroid hormone replacements, but many medical doctors just dismiss if someone has. I mean, really, it's when you look at the lab ranges too. Like if you look at the lab ranges for like postmenopausal for estrogen, progesterone, I mean, if it's 0, it's considered to be okay. I mean, which is crazy.
Exactly. But, estrogen preserves your bones, your
Yeah.
brains, your cardiovascular system. It helps with lipids. And it makes you feel good. And women have to realize that there's been a lot of misinformation about hormone replacement. And I was around when PremPro came out. In fact, when I was a newbie and I had to learn everything about hormones, because these menopausal women came down to me and they wanted to be taken seriously and rise up the corporate ladder. I mean, when I decide to do something, I do it all the way. So I learned from so many people, and I learned a lot. And I realized that when women came to me on PremPro, they weren't quite right. Some of them were a little more depressed. They might have had spotting, and those are synthetic hormones. So PremPro was what they used mostly in that women's health initiative. So I was recommending bioidenticals long before when PremPro came out, and I saw the difference when I sent women for bioidentical hormones. I would have women come down to me and say, I want what she's having. I want what she has, because she's not gaining weight. She's not depressed. She just seems in better, whatever you did, whatever you recommended seems better. And it did. And I converted a lot of women from Prem Pro to bioidenticals. And then I switched companies, and then the Women's Health Initiative came out, and oh my God, all these women stopped their hormones, and it was bedlam. It was bedlam because women just, it was like the plug was pulled out and the rug was pulled out from under their feet. They got all the symptoms of menopause so abruptly, and so many. I mean, I mostly had departments of mainly women, and it was so hard on them. And I still knew and did things differently and kept studying. And, you know, the bioidenticals are safer. And the analysis of that study was very flawed. And hence, in 2017, the principal investigator came out with a paper saying, listen, this study was hijacked. We never even got to see it before the press, you know, came out with this. It's dangerous, right? It increases heart attack and stroke and breast cancer. When you put it in perspective, it didn't do any of that. Well, oral estrogen does. Oral estrogen causes clots. So I was there during all that time, and I continued to study because I continued to help women only because I saw how much they were suffering. So when you don't make a decision and you do so out of fear, you're deteriorating. You know, you lose your bone, your thyroid gets messed up, you start to not remember, you get dry, you can't have relationships because it's too painful. It affects your marriage. You're irritable and can't sleep, and you're tired, so it affects your performance. So there's so many factors to consider, and quality of life is one of them.
Yeah, definitely agree. When do you determine, or how do you determine? Actually, I have a two-part question. So, one, how do you determine when a patient of yours needs bioidentical hormone replacement therapy? And then a second question is if there is a time and place for bioidentical hormones in those with premenopause, so those who are not in perimenopause or postmenopause.
That's a very good question. So first of all, I do this all day, every day, so I know the symptoms, but I don't necessarily treat the symptoms. So I will measure. I will have women do some blood testing, and then I will also detox them, because some of it can be due to toxins. Some of it can be due to inflammation, and inflammation is terrible for your thyroid, and toxins are terrible for your thyroid. So I do a very different type of detox because everybody calls it something different and does it differently. So I say, when you come to me, I want to do it my way once at least, right? You have to bear with me, because I just had a conversation with someone yesterday, and she said, I'm eliminating those foods. I said, that's only one small piece of what's going on. We're going to refurbish you. We're going to remove the toxins. We're going to give you detoxifying herbs. We're going to remove the most common foods just for 2 weeks. I do it very short because otherwise people won't do it. For 2 weeks, you remove the most troublesome foods. You give something to decrease the inflammation, heal the gut, and 80% of people come back to me feeling good to great. So many symptoms go away. And I have actually had some women say to me, I feel so good, I don't think I need hormones. And I go along with that. I mean, if you're really feeling good, and we measure, we subsequently measure, and, you know, a lot of women go back into balance. But then some women, they feel better, but there's still big imbalances. I will treat them, because you don't realize that in perimenopause, that's when you really start losing bone. People think you only lose bone in menopause, but you lose it in perimenopause. And progesterone is extremely important for bones, and so is testosterone. So all of those hormones go down. And I also measure cortisol, because if your cortisol is high, all your other hormones are going to be low. So I decide based on symptoms, based on measurement, based on response to a really good detoxification and elimination diet and decreasing inflammation.
How do you measure cortisol?
I measure cortisol in saliva, 4 points. So you get up in the morning, you spit in a tube, noon, you spit into a tube, 3 to 5, you spit into a tube, and before bed, you spit into a tube. And you should have a nice curve from high to low. And, lately I've been seeing flatline cortisol where there's no get up and go. And that's burnout, where some people's cortisol goes up at night and then they can't sleep. And then if you can't sleep, it disrupts all your other hormones. So it's like baking a cake. You leave one ingredient out and it's a flop. So we have to look at the full picture. And that's what I do when I initially see someone. I want a fuller picture so that I can hit all the key points, get them feeling better faster. And then we decide, when the dust settles, okay, whatever's left over, we treat. So then, and I save people a lot of money on supplements because I have people coming to me, every symptom has a supplement. So it's no different than a pill for an ill. So it's a supplement for a symptom, and that's not getting to the root cause. So then I give the supplements based on what's left over. And then I give the hormones based on what's left over and where are you at? Because I know even if you feel a lot better, if you're still having either symptoms or your hormones are low, you're setting yourself up for problems down the road.
Yeah, agreed. And I'm glad you use saliva testing. I do a lot of saliva testing too, just because you could look at the circadian rhythm as you described. And when you do a blood test, like you mentioned, elevated cortisol, if someone does a blood test and cortisol is high, is it truly high? Is it because they were stressed out while doing the blood draw? So you could have that false elevation of cortisol when doing serum testing. Do you do any Dutch testing in your practice?
Yeah. Once I put people on hormones, I do Dutch testing because, the mistake I see some people making is they take a menopausal woman who has no estrogen and they do the Dutch test, which is helpful to an extent, but it's not as accurate. So I get the hormones to a certain level, and then that's when it's really testing the pathway, right? When you have enough estrogen in there to see where is it going, how's your liver metabolizing it, can you get rid of it? So if you don't have any estrogen there, that's not going to be very accurate. So as I give hormones, I tell people I look at it 3D. Because if I did your financial plan, I'd have to look at your bank account, your savings, and your income and expenses to do a good job, right? That's a complete financial plan. But if I just looked at your blood, that's like your bank account. So, you have enough money. Yeah, but you have no money in savings. Like if something comes, something happens, you don't have any reserve. So saliva is not the most accurate test, but it gives me a good idea because that tests free hormone and it doesn't always match the blood. But that, a certain company did some tests that when they did uterine biopsies and looked at the hormones in the endometrial lining and they did saliva, they match. So it gives me an idea how much free hormone is floating around. Because some women, I can give them, hormones till the cows come home and it doesn't rise in blood. So I have to look, where is it going, right? So then I do blood and saliva to see how they compare. And then I do blood and the Dutch test. And the Dutch test is so valuable. And it tells me how the body metabolizes all of the hormones. So that if your liver, I call it the giant recycling plant, you can have clean recyclable garbage, dirty, stinky garbage, and something in between. If you make this 4-hydroxy estrogen, which is like dirty, stinky garbage, it damages DNA. And they did a study that women who made 4-hydroxy estrogen either had a history of breast cancer or a family history of breast cancer. So I want to know, do you make a lot of that? And if you do, I give you diet and supplement advice to make more of the 2-hydroxy estrogen, which when they did studies on women who made that, it's like clean recyclable garbage, right? So I can shift the enzymes to make more of the safer version. And then I have to see, if you just throw garbage out on the curb, the garbage man is not going to pick it up, right? So if you just had these hormone metabolites floating around, you could reabsorb them if you don't have a good active methylation process. So that's methylation is done by the COMT enzyme, which it's like putting those toxic metabolites or even the safe metabolites in a bag so you can dispose of them. And that's why I'm such a stickler for bowel movements. I'm going to be known as the poop doctor because are you moving your bowels? Because if you're not, you're reabsorbing all those things you want to get rid of. So the Dutch test is going to tell me how you get rid of them. It's also going to tell me how you're metabolizing your cortisol. It'll give you a cortisol curve. It's going to tell me if you metabolize testosterone to a form that's going to give you more masculine features, like I have the goat beard and mustache, and you can get more of that if you metabolize or break down your testosterone into a form that's more androgenic. So think facial hair, but hair loss on the head. I mean, God has a sense of humor, right? You get hair where you don't want it, and you don't have it where you do want it. But I can see all of that in the Dutch test. I love that test. I love that test.
Yeah, no, I like it a lot too. Getting back to the 4-hydroxy, if you have the elevated if a patient of yours has elevated 4-hydroxy, so making sure they have regular bowel movements, make sure they have healthy methylation, supporting methylation if necessary. Uh, Anything else like cruciferous vegetables or this dienzolamethane at times, like
Yes. So I will give diindomethane. I have a cocktail. I have different cocktails for different enzymes. They're the one that's in between, not as toxic as the 4, not as clean as the 2. That responds better to resveratrol. That's the 16-hydroxy. But all estrogen dominant, and if you can have high estrogen, normal estrogen, or low estrogen and still be estrogen dominant. So you could be menopausal and be estrogen dominant. So you decrease the toxins coming in. So decreasing, eating organic, because the herbicides and pesticides act on the estrogen receptors and make you gain weight and make you estrogen dominant. Hormone free, antibiotic free, meat, poultry, dairy. Look at your personal care products, because a lot of them have chemicals that disrupt your hormone system, your immune system, and your nervous system. And some people take certain creams that have hormones in them. They don't realize it. Like yesterday, I just got a blood result back with somebody's estrogen at 799. That is the highest. So it's either a lab error or she's taking a skin cream, because a lot of the estrogen skin creams are very nice. And some people don't realize it. But if the estrogen is 799 because of that, she's in trouble. So really look carefully at your skincare products and your cleaning products. So that decreases the toxins going in. Cruciferous vegetables help you break down the estrogen, we call it metabolize, into safer forms like the 2-hydroxy instead of the 4-hydroxy. So I make sure people get a lot of cruciferous vegetables. And the other thing is fiber. Fiber binds the metabolites and allows you to poop them out, right? So a lot of women say, oh, how are your bowel movements? Oh, they're normal. Like, tell me, how often? Oh, every 3 days. What do they look like? Oh, pebbles. That's not normal. That's not good. That's not going to help you get rid of your toxins. So you got to poop a snake every day. I had to say that over lunch, and I didn't really like saying that over luncheon, but you know what? It is so important, because women come to me and they just don't feel right and they're fatigued. Any toxins you're trying to get rid of, you're just reabsorbing if you're not pooping, right? It's like flushing a backed up toilet. Ew, bro. So I mean, people tell me they feel absolutely great. Oh my God, I didn't realize it made a difference. And then the other thing is gallbladder. A lot of women had their gallbladders out, or their gallbladder doesn't work well. And they don't realize that bile has it's more than just digesting fat. Bile it binds toxins and helps you get rid of them. And bile is an antiseptic for your bowel. So all this dysbiosis, meaning you have a family of microbes in your gut that are not friendly versus the friendly, bile helps you. And your microbiome, the bugs in your gut, can take the bile is bound to this, all these toxic metabolites, and it's carrying it out. So some of the microbes are kind of sneaky. They're like, oh, you think you're smart? I'm going to just break it off. So then you just reabsorb this stuff, and that's called beta glucuronidase. It's an enzyme that they make so that your bile can't get rid of the stuff. You reabsorb it, and you're estrogen dominant, but it's not going to measure because it's a metabolite. It's not going to measure in anything except. So getting your bile flowing is really important. And, I recommend bitters and maybe sometimes TUDCA. And I had a woman, she came to me like 4 weeks before she was going to have her gallbladder removed. And I said, I think I need a little bit more than 4 weeks. So she was having a lot of pain and gas and just digestive issues. And we got everything going. And she's like, okay, things are better. Things are better. And she didn't have to have the surgery. But if you did,
Awesome.
if you did have your gallbladder out, make sure your bile is flowing.
Yeah, yeah, agree with that. I mean, gallbladder problems are really bile metabolism problems, and
Yeah.
remo- yeah, there's a time and place to remove the gallbladder, but it's not fixing the problem. Just like anything else, removing there's a time and place for thyroid surgery, but if someone
Yeah.
has thyroid surgery, is it fixing the underlying cause of the problem? I mean, especially if they have like Graves' disease and they ends up getting radioactive iodine thyroid surgery, but it's more of an immune system condition than a
Yeah.
thyroid condition. So yeah, it's I'm glad you brought that up as well with the importance of supporting the bile. So thank you for that. Do you do stool testing then to look at like beta glucuronidase and the gut microbiome overall?
I don't do it in everybody because some people feel so good and they don't want to spend the money on it. But
Mhm.
when somebody doesn't feel better after my detox, I say, we got to look deeper. It's mold, it's metal, it's a gut, and yeah. And lately I'm seeing, when I first started, I used to see a lot of bacteria that didn't belong there. But now what I'm seeing more is, I call it a desert. People have no probiotics. They've been treated with antibiotics. They're not eating enough fiber. They're not eating enough fruits and vegetables. And there's nothing in there that's going to help you, because people don't realize that microbiome, there's more cells in there than there are in our bodies, and that the microbiome is like your community. They're communicating. They can disrupt your hormone system, your immune system, your nervous system, or they can make it great. So having the right balance of the microbes there is important. And the other point, and even thyroid, you need iron, you need iodine, you need nutrients to make thyroid hormone and to make any hormones for that matter. But oftentimes the digestion is off. We're eating on the run. We're not relaxing, and you're either in fight or flight, or rest, digest, reproduce, regenerate, right? So if you're eating on the run and multitasking while you're eating, you're not relaxed enough to get all the signals from your brain to your gut to make digestive enzymes, and you're not digesting the food. So therefore you're not absorbing the nutrients. And I say choose, chew, and chill. Choose the foods that nourish you. Chew thoroughly, because the chewing releases stomach acid, and then the stomach acid starts the digestive process, and that actually is antibacterial. So all your people with SIBO, small intestinal bacterial overgrowth, you need stomach acid, and you need stomach acid to absorb iron, and iron is essential to making thyroid hormone. So the stomach acid is then going to tell your gallbladder to make, your liver to make bile, and it's stored in the gallbladder, and your pancreas to make other digestive enzymes. So if you don't give time, it's like rushing through a car wash. You've got the suds on, but then you rush through the rinsing process and you're kind of stuck there. So take a little time to eat and chill out. Choose, chew, and chill. Relax when you eat, so that this way all your digestion will take that food and allow the nutrients to absorb. That's it's so many little things, and that's why people just think, oh, just give me hormones and my GYN will give me a standard dose and I only have to see her once a year. Well, is she taking care of all the other things, or he or she? And no. So if you really want good overall health and a good, healthy health span, I can't guarantee a longer life, but while we're on this planet, why shouldn't we live with vibrance and vitality and a sharp, clear mind and energy and feeling good?
Yeah, fully agree. We all want to feel good, and sometimes we gotta also pay attention to the smaller things like chewing our food. I have two teenage daughters, and one of them always have to say, slow down, 'cause she likes to scarf down her food and do whatever she's doing. So yeah. So again, very important to talk about even the basics, because so many people aren't doing the basics, and like you said, they're eating quickly or not really. They might be on their computer while eating and or watching TV. Not to say there's not a time and place to do that, but they're not focusing on,
Yeah.
just not relaxing. Not to, they're just trying to eat a quick meal in between their break, for example, and get back to work. So yeah, try to block out some time. And yeah,
Or they
so
eat in their car. I mean, oh
yep.
my God, I had so many people that used to eat in their cars,
Yeah.
stuff.
Yeah, no, thank you so much for bringing that up. So
It also affect your thyroid, because if anything that causes inflammation is going to affect your thyroid. And I had a woman the other day where I know she's a sugar addict. So her TSH, thyroid stimulating hormone from her pituitary gland, went up again, and her other levels were fine. Oops, yeah. So I said to her, you know what? Please stop the sugar and then let's remeasure, because that inflammation affected the communication between her thyroid and her pituitary gland. Came back normal. Otherwise, somebody might have put her on thyroid hormone. And I said, you know
yeah.
what? I don't like when people overdo hormones either. There's a time and a place, and that's why reducing inflammation and taking care of all these other things makes all the difference.
Yeah, that is awesome. I'm so glad you take that approach and not just have a cookie cutter approach where everybody gets hormones. Again, I'm not against hormones. There's that time and place, but it's not like everybody. You try to improve the person's health, and if someone needs hormones, great, they need them. If someone doesn't need them, then they
Yeah,
don't need them.
right. Exactly. It's getting to the root cause. And that's why I have so many people that say, I feel so good. I don't, and then they don't need anything, right? They don't need anything. And I just had somebody came back to me. I did my process. She was great. And now it's like, I think 7 years later, she said, now I need them. So I said, okay, let's measure. Let's measure.
Yeah. Wonderful. Well, you covered a lot of great information. Anything before we wrap up, anything else you want to mention? Anything that I should have asked you that I didn't ask you?
No, it's just I always like to end with telling people to have some fun, enjoy life. Some people approach this like a checklist. Check, I ate, I exercised, etc. But they're uptight about it. They're too anal about it. Relax, enjoy, have fun. And I know a lot of women have fear about hormones. And I have a course called "Is HRT Right for You?" And it will lay out all the studies and also have you do a self assessment. What would happen if you did take hormones? What would happen if you didn't take hormones? What are the risk factors? How is your life going to be different with and without? And I also give you a list of the studies. So the studies, I mean, I've been doing this for so long, and it makes you feel comfortable because the latest studies show that the bioidentical hormones are safer. And then I also, the part 2 of the course is what to expect if you do go on hormones. But that's a paid course, and it's very reasonable. However, I have a Hormone Harmonize Kickstart that I'd like people to download for free. And it will go through a lot of these things, and it'll give you a little bit more detail about what to do. Because we're taking care of the whole person, not just one gland, your thyroid, or not just your estrogen and progesterone and testosterone or your cortisol. So the Hormone Harmonized Kickstart gets into a lot of the things that I covered here. Because I know I was a little bit divergent in many places, but I can't help it. I mean, that's how I think. I will go and hone in on different things so that I can get to the root cause faster.
Yeah, no, that's wonderful. We'll make sure to include the links in the show notes to the Hormone Harmonized Kickstart, as well as Is HRT Right for You program. Anything else like your website, or where can they find you on social media?
Yeah. I have 2 websites. It's confusing, but I have the coaching website, which is the Feel Good Again Institute. And then I have my medical website, Vibrance for Life. So the feelgoodagaininstitute.com, vibranceforlife.com. On the field, I have a private Facebook group. You can just use my name. Instagram is my name. The Facebook group is my name. Or I have the private group is the Feel Good Again Institute. So you can find me all over, and I'm even on YouTube.
All right, wonderful. Well, thank you so much, Dr. Lorraine. This was an amazing conversation. Really, had a great time talking to you about thyroid, about autoimmunity, about hormones, and yeah, definitely check out again Dr. Lorraine's website. Find her on social media. Sign up for her Hormone Harmonized Kickstart, and maybe check out her HRT program as well.
Thanks so much. You got to spread the word because I like people to feel good again. That's why I named my company the Feel Good Again Institute.
Yep, I agree. I agree. Well, thank you again. Thanks again, Dr. Lorraine.
Thank you.